Hello everyone, good evening and welcome back to our YouTube channel Upclone. And in the last class we had stopped with Anchorage. So in this today's class I'll be continuing with the rest portion of the Anchorage. This is basically for the UG segment. Okay. So the last segment I just wanted you people to understand what an anchorage means. So it is just the anatomical unit that resists an unwanted tooth movement. So anchorage is the basic thing that we need to have a great knowledge on when you are thinking of an orthodontic tooth movement, because you want a tooth to move. You are taking a force from one another tooth there, then you should know what all things will happen to that another tooth there where you are taking this anchorage from, right? So today's class I'll be discussing mainly on the sources of anchorage and how each thing is. Okay, so let's go back to our class, that is our anchorage. Okay, so yeah, there it is, anchorage. So today we will just proceed with the further. So next topic is the types of anchorage. So we have different types of anchorage. There are so many types of anchorages we have. When you are thinking, we have around 11 types of anchorage that can be seen. 11 types. Just think 11 type of anchorage. Okay, let me just adjust my video there so that it will be very clearly visible there. Okay, so 11 type we have. So first one is the simple anchorage, then we have the stationary anchorage, we have reciprocal anchorage, we have single or primary anchorage, we have intraoral anchorage, we have extraoral, muscular and intermaxillary, compound anchorage and reinforced anchorage. Yeah, I know that it may be very difficult to memorize all this. So for that we have a small thing there. We have a small thing there. Okay, so and this let's just think of this situation. Okay, it's a small story which I used to tell to my students to memorize things there. So just imagine a scenario where you are sitting inside the exam hall and your lover is there, sitting right there, and she's looking at you. Your lover means she's looking at you, not at us. So she's looking at you, and your name is Ram and her name is Sita. Okay, Sita, it will be better to remember. Ram and Sita will be better to remember, but Sita spelling will be like SISTA. Okay, so and outside it is raining. Okay, so outside it is raining. You are sitting inside the exam hall. You both are interacting with your eyes. Okay, so Sista and Ram sit together in exam hall looking eye to eye completely when rainfall, right? Sista and Ram sit together in exam looking eye to eye completely when rainfall. So S and S there, so it is simple and stationary. R stands for reciprocal and SI stands for single or primary anchorage, and then IN stands for intraoral, EX stands for extraoral, M stands for muscular, I and I stands for intramaxillary and intermaxillary, COM stands for compound, and R stands for reinforced or multiple anchorage. So it is Sista and Ram sit together in exam looking eye to eye completely when rainfall. Okay, so SI means single, stationary, R for reciprocal, and SI for single and compound. Okay, single, and IN stands for intraoral, EX stands for extraoral, M stands for muscular, I stands for intermaxillary and intramaxillary, COM stands for compound, and R stands for reinforced. So Sista and Ram sit together in exam looking eye to eye when completely rainfall. I know that I myself had a little difficult to all those phrases put. So this is the thing which I think I learned in my UG level typewriter. So I just remember this one, but I am just finding it difficulty to pick it up each and everything. Okay, so don't worry, you just remember this phrase there and everything will come to you. So when you are looking and reading multiple times, it will definitely will come to you. So let's go individually onto each and everything there, all these 11. So a simple anchorage is defined as a dental anchorage in which the manner and application of force is such that it tends to change the axial inclination of the tooth. So basically, in simple terms, it means that a resistance for an anchorage unit to tipping. So one tooth is there, our molar is there. So you are giving an elastic, and now the teeth have a tendency to tip. So the resistance offered by the molar for this particular tipping, molar is just an example. So a resistance offered by any anatomical unit for tipping type of tooth movement is called as anchorage. Okay, simple anchorage means resistance to tipping. So the resistance to tipping is used to move a teeth. Okay, so the combined root surface area of the teeth forming the anchorage unit must be double that of the teeth to be moved. Okay, so here in this example you can see that the number of root is more, or the root surface area is more for molar, while root surface area is lesser for the incisors. So you are giving an elastic, incisors will tend to tip, and this molar have an resistance towards tipping. That kind of anchorage is called as a simple anchorage. Okay, so this is an example which is given in your textbook. So you can see there. So the anchorage is taken from all the surfaces here, and in this particular all these areas they have taken anchorage. So this is the teeth which will tip towards this particular portion. It is not going to move bodily, it will only tip into that particular portion. So the resistance offered is called, means for an simple type of tippy type of movement is called as and simple anchorage. Okay, so next one is stationary. So it is defined as the dental anchorage in which the manner and application of force tends to displace the anchorage unit bodily in the plane of space in which the force is being applied. So the thing is, for tipping type of movement you need only little amount of force. For bodily movement you need little bit higher amount of force. That is there. And also tipping type of force you will be taking the force not from the exact center of resistance, while for bodily movement you will be taking the force, or you will be passing the force through the center of resistance. So those things are different. Okay, so an object you are trying to move it bodily. So when you are trying to move an object bodily, the manner of force that you are taking from the anchorage unit is called as stationary anchorage. So when you are thinking of a bodily movement, now the object from which you are taking from, or the site or the tooth or whatever things that you are taking anchorage from also have a tendency to move bodily. So that kind of anchorage is called as stationary. So here, so when you are thinking of the stationary movement, there the force will be higher and it will be passing through the center of resistance. So you need little bit higher number of teeth to support. That means the more the number of teeth in the anchorage unit, it is better anchorage will be provided. So in this situation there you can see in the anterior segment we have the molar there, and you are trying to move this particular teeth, and this is the our posterior segment, and you are using an elastic to move bodily. Now this, when you are thinking of the posterior segment, earlier it was only one tooth there, right? Only one molar was there. Here I have added one more teeth because the force and the manner of force, everything differs for a bodily type of movement. So the anchorage for this kind of bodily type of movement, so the anchorage unit that resists these kind of bodily movement are called as stationary anchorage. So the anchorage provided by the tooth resisting bodily movement is considered greater than one resisting tipping force. So bodily versus tipping. Next one is a reciprocal anchorage. So reciprocal anchorage everywhere, you can see reciprocal type of anchorage. So one person is doing an arm wrestling. Arm wrestling, you know what is an arm wrestling, like this, you push. So there it is a reciprocal type of force is happening. In this picture itself, you can see two girls, they are just, what to say, swinging. So they are also taking type of reciprocal anchorage, because their force and the manner of force applied will be, the other girl is trying to, the blue wala girl here, she is trying to push the red towards her, the red is trying to push the blue towards her. So there, this is kind of force is called as reciprocal anchorage. So generally refers to the resistance offered by two malposed units when dissipation of equal and opposite force tends to move each unit towards and more to a normal location. Okay, so this is a situation where you can see this one is given in the textbook. Okay, now it will be much clear there. Okay, so a closure of midline diastema by moving two central incisors towards is one great example for a reciprocal type of movement. Okay, closure of midline diastema by moving the two central incisors towards. So in this picture they have used finger spring. In the first picture there, in picture A, they have used finger spring. So this will be moving that side and this will be moving this side. So this kind of force, the anchorage taken here will be reciprocal anchorage. So the great example is here. So they have put one elastic on this central incisor and they have put one same elastic extended to this. So the tendency of the elastic is to compress. Okay, so the elastic will produce a reciprocal anchorage on each teeth. So both the teeth moves. Okay, so this is called as an reciprocal anchorage. Okay. Okay, this is another example for reciprocal anchorage where you use an crossbite elastics. So these two teeth are in crossbite. You know how two molars should be. Two molars should be occluding like this, not like this. Should not be occluding like this. It should be occluding this way. Should occlude. Should not be this way. So now let's consider this kind of things are called as, this kind of an malocclusion is called as a crossbite. So you give two attachments on the maxillary teeth. You are giving an attachment on the buccal side or whichever side. Okay, and you are giving it one in the opposite side and you are just engaging an elastic like this. So you can see it comes. So the lower teeth is pulled outward. Let's consider this area is the buccal side and this is the palatal side, or this area. Okay, let's consider this is the buccal side and this is the palatal side. This is the buccal side and this is the palatal aspect. So on this 6 you have on the buccal aspect, on the molar, lower molar you are placing it on the lingual aspect and you are placing it. So you can see it moves towards, right? So this kind of force is called as an reciprocal force. Okay, couple not couple, reciprocal anchorage. Okay, so here you are taking for this particular molar, the upper molar, you are taking anchorage from the lower molar, and for the lower molar it is taking anchorage from the upper molar. So both the units moves. So in reciprocal anchorage both the units moves. Okay, so this is one another example where an arch expansion is used. So it is just pushing both sides. So this side is taking anchorage from this side and this side is taking anchorage from this side. So it pushes both the sides. Okay. Next one is the intraoral anchorage. So intraoral anchorage can be further divided into intramaxillary and intermaxillary. Okay. So the anchorage in which all the resistant units are situated inside the oral cavity. So in intraoral we have all the anchorage units that are placed inside the oral cavity, and in extraoral all the anchorage unit will be placed on the outside the oral cavity. Okay. So all those things which are placed inside the oral cavity are called as intraoral, and all those which are placed outside the oral cavity are called as the extraoral. So inside the teeth we have the teeth. So inside the oral cavity we have the teeth. We can take anchorage from the palate, we can take from the lingual aspect, from inside the muscles you can take. So wherever you can take inside the oral cavity, all those comes under intraoral. Okay. So we have two basic types. We have intramaxillary and intermaxillary. So intramaxillary means intra, within the arch. Inter means between the arch. Okay. So intramaxillary, here you can see they are taking anchorage from this molar and one elastic is placed. Okay, So same arch is intramaxillary. So here you can see the lower molar, from lower molar to upper canine. So he is taking anchorage from this lower molar for the upper canine. Got it? So in this particular situations, you can see the upper molar have a tendency to move anteriorly here, and upper anteriors have a tendency to move posteriorly. But here you can see the lower molars have a tendency to move anteriorly, while lower posteriors have a tendency to move anteriorly, while upper incisors and the canines have a tendency to move posteriorly. So this is intermaxillary and this is intramxillary. So one is within the arch and this is between the arch. Within the arch means within the maxillary arch itself. Other one is between maxilla and mandible. So this within the arch can be either on the maxilla or it can be on the mandible. Okay. So other one is between maxilla and mandible, whichever way you can take. So intramaxillary, when all the units offering the resistance are situated within the same jaw, just like I told before. So in this type of anchorage, the teeth to be moved and the anchorage units are all situated in the same arch. In the maxilla, if you are thinking of moving a maxillary teeth, you are taking anchorage from the maxillary teeth itself, then within the same arch. That is what intra means. Inter means you are taking between. To move an upper teeth, you are taking anchorage from the lower teeth. To move a lower teeth, you are taking anchorage from the upper teeth. So that kind of anchorage is also called as Baker's anchorage. Okay, so that is asked as a short note. That used to asked as a short note always. So that kind of anchorage is called as Baker's anchorage. Okay, so this is an example. So here the maxillary teeth moves backward while the mandibular posteriors moves anteriorly. So he have taken an anchorage intramaxillary. So this kind of anchorage is also called as Baker's anchorage. Okay. So for class 3 malocclusions. So previously this is for a class 2 type of malocclusion. So what happens in a class 2 malocclusion is we have a more anteriorly positioned maxillary molars and posteriorly positioned mandibular molars. Okay, with an increased overjet. So you want the maxillary anteriors to come backward to reduce the overjet, and also you want the mandibular molars to come forward so that this class 2 becomes a class 1. Got it? Let me explain once more. In this particular situation there, when the patient occludes, there is an increased overjet. So you are taking an anchorage in this particular situation, then what happens is, for that increased overjet to come into a normal, you need the maxillary anteriors to come backward. Okay. For that class 2 molar relationship to get corrected, you need the mandibular molars to move anteriorly. So in this particular situation, that is going to happen because the anchorage unit is the molar and the force taking unit is the maxillary anteriors. So maxillary anteriors have a tendency to move backward, while the mandibular posteriors, that is the molar, have a tendency to move forward. So that molar will become a class 1 and overjet will get reduced. Okay. In class 3 situation, it will be just the opposite because it is a reverse overjet. You want the mandibular molar anteriors, mandibular incisors to come backward so that negative overjet will become a positive overjet. Okay. But we know that in a class 3 molar relationship, the mandibular molars will be more anteriorly positioned than the maxillary molars. So you need the maxillary molars to move anteriorly. So this kind of anchorage helps in that kind of correction. That is, the maxillary molars move anteriorly and the mandibular incisors comes backward. So these kind of class 1 and class 2 type of elastics, class 2 and class 3 type of elastics are also called as Baker's anchorage. Okay, they are also called as Baker's anchorage. So Baker's anchorage, this is class 2, this is class 3. Class 1, we don't give a Baker's anchorage. This is the first picture. This one is a class 1 anchorage. Class 1 class 1 means you are taking the anchorage from the same arch. Okay, this is one is a class 1 elastics. This is a class 2 elastic, that is this is a class 2 elastic, and this is a class 3 elastic. So class 2 and class 3 elastics, that is an intermaxillary elastics, are also called as Baker's anchorage. Okay. So next one comes to the extraoral anchorage. So there are many places where you can take extraoral anchorage from. We have the occipital region, we have the parietal regions, and we have the back of the neck. Okay, we have the forehead and we have the chin. Okay, we have occipital region, we have the parietal region, we have back of the neck, and we have the chin and forehead. Okay, so occipital region is a place where you are taking our headgear. We are using a headgear, so that is taking an anchorage from our occipital region, and parietal region again combination headgear, mainly cervical pull headgear is there. So all the headgears we are taking anchorage from this parietal region and occipital region, parietal region, and also from the back of the neck. Forehead and chin means we are taking a reverse pull headgear and chin cap. Chin cap and reverse pull headgear takes from the forehead. So here is an example. So for this here chin cap, they are taking anchorage from, this is the parietal region and this is the occipital region. This is an reverse pull headgear, so he is taking this particular, is taking anchorage from here. This is the forehead, and also from here chin. Okay. So next one is the muscular anchorage, where we uses the tonicity of the muscles. Okay, muscular tonicity as well as the muscles action we take for anchorage. So this is a good example. There we use a lip bumper. So you want this particular molar to move backward, you are giving a lip bumper. So whenever the patient force closes the lips, it pushes the lip bumper backward. When it is pushing the lip bumper backward, it is attached on the molar moves backward. So you are taking anchorage from lips. Okay, so this is a good example for muscles. Next one is a single or primary anchorage. Single or primary anchorage means resistance provided by a single tooth with a greater alveolar bone support is used to move lesser teeth. That is an for example, what let's say you just an extraction site is not closing. That is let's come. Just imagine that there is a space between the premolar and molar. You just need the molar to move, not the molar, you just need the premolar to move little towards the molar. You know that molar's root is much higher surface area than the premolar's root. So you are simply giving an elastic from the molar to premolar. Okay, you are just simply giving an elastic from molar to premolar. So that is a single or a primary anchorage. Okay. Compound anchorage means to move a group of teeth, you are taking anchorage from a group of teeth, or to move a single teeth, you are taking an anchorage from a group of teeth. Single anchorage means you are taking anchorage from single tooth. Compound means you are taking anchorage from a group of teeth. Okay, so single means single tooth, compound means teeth, group of teeth. Okay, that is a single and compound. Reinforced anchorage means, I just keep this picture in mind. You will know what a reinforced anchorage means. Okay, what do we mean by reinforcement? So whenever something is supply or whenever something is less, you add something, it is called as reinforcement. Okay, for example, military unit, there might be 10 military warriors there, and some severe attack is going on. They will call the headquarters and they will ask for reinforcement. Reinforcement means many more military warriors to join them. So when many more, 1,000 comes and join to this 10, now that 1,000 is a reinforcement. Okay, you don't have food supply, you don't have in your storeroom, in your house storeroom, if you don't have rice there, you buy one sack of rice, 50 kg sack of rice, and you keep it. That is a reinforcement. Okay, so whatever you are giving in addition to something that you have, that is called as reinforcement. Okay, so there are so many ways in which you can reinforce anchorage inside the oral cavity. So let's see what all those things are. So in this anchorage situation where more than one resistance unit is employed, so resistance unit becomes more effective when more units are added because the reactionary force is distributed over a larger area. So there is a very good example of reinforcement where we are using a transpalatal arch. We are using a transpalatal arch for holding this. Now what happens here in this particular session, just these are two teeth, this is two teeth, you are just connecting with a transpalatal arch. Now this become four teeth become a unit, single unit. Now this transpalatal arch is a reinforcement there. Okay, so this is an headgear. Okay, here you can see the patient is wearing a beautiful blue headgear there. So she is also wearing a braces. So what happens is the molars have a tendency to move anteriorly when you are giving an elastic. So to stop the molar from moving anteriorly, you are asking the patient to wear an headgear while sleeping. Okay, while sleeping, just while sleeping. So the headgear prevents the molar from migrating or having an anchorage loss. The headgear will prevent the tooth from having an anchorage loss. Okay, so this is called as this type of augmentation of anchorages are called as the reinforced anchorage. Okay, so I am not going to talk much on anchorage augmentation. Anchorage augmentation, there are so many ways by which you can augment the anchorage. Anchorage augmentation can ask as a separate question. Anchorage augmentation can be asked as a separate question. So anchorage augmentation means reinforcement of the anchorage. There are so many ways by which you can reinforce anchorage. For example, you can give a TPA, you can give a lingual arch, you can give a lingual arch, you can go for a extra oral anchorages like headgear, you can go for mini implants, temporary anchorage devices. We have mini implants. Okay, and zygomatic implants are there. You can take if the patient is having an ankylosed teeth, you can take anchorage from that also becomes an anchorage augmentation. So or these are the different ways by which you can augment the anchorage. Yeah, this is base plate that is taking anchorage. Okay, so let's discuss on the different ways by which you can increase anchorage. Yeah, previously I told I will not be discussing it, but no worries, we have to go through it. So maximizing the root surface area is one of the ways by which you can augment the anchorage. So what are the different ways by which you can maximize the root surface area? You incorporate 7 into the system. Okay, previously I told that we will be taking anchorage from first molar. You take anchorage from second molar also. Okay, so that is one extra tooth is getting anchorage. So the root surface area is getting increased. Root surface area is getting increased. So that is one method. So tipping versus bodily movement. So what we used to do is if you are thinking that the patient might end up in an anchorage loss, you initially tip the teeth and then upright it. Okay, that is one method. So because tipping requires lesser force when comparing to a bodily movement. So initially you just tip like this. Okay, you hold this position and then you upright. Okay, you tip, hold it, upright. Now you can see it is moving like that. Okay, so that kind of treatment modalities can also be employed. So tipping versus bodily movement. Next one is the occlusal forces and growth pattern. So growth pattern of an individual greatly influences the occlusal force produced by the person. Okay, so a person exhibiting a horizontal growth pattern with a low mandibular plane angle produces more force that resists mesial or vertical movement of the posterior teeth. Got it? Yeah, I know you are confused. So a person exhibiting a horizontal growth pattern with a low mandibular plane angle produces more force that resists mesial or vertical movement. അതായത് you are placing an elastic from molar to the canine. There is no first premolar. First premolar is extracted. Now you are giving an elastic from the posterior segment to the anterior segment. Okay, you are giving an elastic from the posterior segment to the anterior segment. Now if the patient is having an horizontal growth pattern, if the patient is having an horizontal type of growth pattern, since the occlusal force is more, the mesial migration of the molar will be little bit reduced. Since that occlusal load is more, that for an horizontally growing patient, the occlusal force will be more when comparing to an vertically growing patient. Since that occlusal force is more, it will have an higher anchorage, because since the occlusally it is also giving a pressure like this, it won't migrate anteriorly. Vertical movement of the posterior teeth, that is what it is telling. Okay, so a person exhibiting a horizontal growth pattern with a low mandibular plane produces more force that resists mesial or vertical movement of the posterior teeth. Okay, so including second molars into the treatment. Previously I told you are thinking of increasing the root surface area, includes the second molar. You just imagine that particular situation, you are doing a tug of war. One side tug of war means you should have equally. Let's say we have 4 members here, 4 members here, they are going for a tug of war. What happens if I am adding 5th member there? Who do you think will lose? The members with the lower number of teeth will lose, right? So you add 7 into the system or 8 into the system, or you just initially take only the canine and move it backward, and then later on you think of retracting the lateral incisor and central incisor. So you add a tooth into the system, into the anchorage unit, it have a higher anchorage value. That is what including the second molar into the system means. So selection for teeth for extraction. So this is let me put selection of teeth for extraction. Okay, so here let me explain it. Okay, so here you are extracting 4, here you are extracting 5. Okay, so when you are extracting a 4, always think that the posterior segment is what we think when we are thinking of an anchorage. You say anchorage, I am going to augment anchorage, means you are going to increase the anchorage value in the posterior segment. Okay, whenever you think you are augmenting or you are going to increase the anchorage, that means you are going to increase anchorage in the posterior segment. If the posterior segment is moving anteriorly, it is set as anchorage loss. We are losing our anchorage. So there are situations where we need anchorage loss to happen, and there are situations where we need anchorage augmentation to happen. It is not always that, not just think that orthodontics means just extracting a teeth and retracting. No, orthodontics means you can move teeth whichever direction you want. So according to the cases, there are cases where you need to procline teeth. For example, class 2 division 2 condition. In a class 2 division 2 condition, the anterior teeth will be retroclined like this. Incisors will be retroclined like this. You have to procline it. Got it? You have to procline it. So that is proclination is what is happening there. Proclination is the ideal treatment for in that particular situation. Don't always think that orthodontics means you have to retrocline the teeth. So there are situations where you need anchorage loss to happen, and there are situations where you need anchorage loss not to happen. So if you are thinking of an high anchorage case, then you have to extract a 4, because when you are extracting 4, there will be canine, lateral and central incisor in the anterior unit, while there will be a 5, 6 and 7 in the posterior unit. Okay, when you are extracting a 4, 3 teeth in the anterior and 3 teeth in the posterior. But when you are thinking of the root surface area in the posterior, think premolar is having 2 roots, molar is having 3 roots, 7 is also having 3 roots, higher anchorage, right? But when you are thinking of this particular scenario where you are extracting a 5, now 4 is there, 3 is there, 2 is there, 1 is there in the anchorage unit in the anterior segment. You have 6 and 7 only in the posterior. So what happens? Posterior will be forced to move anteriorly while anterior will be staying there. Why it is? Because anterior is the number of tooth and root surface area will be more when you are comparing with the posterior. Got it? So the posterior have a tendency to move anteriorly. So according to the situation whether you need the posteriors to migrate anteriorly, you extract 5. If you don't want the posterior to migrate anteriorly, you extract 4. Okay. So in a situation of a class 2, in the situation of a class 2 correction, class 2 means anterior shows an increased overjet, anterior shows an increased overjet, and in posteriors you can see the maxillary molars will be more mesially positioned than the mandibular molars. A class 1 means mesiobuccal cusp should be in the mesiobuccal groove. It will be in a line. Okay. A class 1 will be like this. A class 1 will be more like this. This is the mandibular and this is the maxilla. It will be in a halfway. A class 2 means this is the anterior segment. Okay. This is normal. This is a class 1. A class 2 means maxillary molar is more mesially placed. A class 3 means mandibular molar is more mesially placed. So in a class 2 situation, in order to overjet to reduce, you need a maximum anchorage in the maxillary arch, while you need lower molar to come anteriorly, so that like this, you want the lower molars to come anteriorly so that this class 2 molar relation will become a class 1 molar relation. Class 2 to become a class 1. So what we do is, what will be our extraction choice will be, in the maxilla we will go for a first premolar, that is fourth teeth first premolar extraction, so that posterior's anchorage will be more and anterior's will come back, the overjet will get corrected. You want the lower molar to move anteriorly, you need an anchorage loss to happen. So in a class 2, upper 4, lower 5. Just opposite is what we do in a class 3. You need the lower anteriors to come much backward, so you need an higher anchorage in lower, so you extract a 4 in the lower. You don't want the maxillary tooth to get retracted, while you need the maxillary posteriors to come front, so you extract a 5 in the maxillary arch. Okay, so that is with the selection of tooth. So according to the situations and according to the scenarios, we extract. So next one is the uses of extraoral anchorage, which I have mentioned already. Uses of lingual and transpalatal arches, again I have mentioned earlier. So next one is the separate canine retraction. Okay, separate canine retraction. So why the canine? Canine is the one which is having a higher root when you are thinking of the anteriors. When you are thinking of the anterior segment, canine is the one with a higher. So in a higher anchorage case, you don't want the maxillary or the mandibular, you don't want the posteriors to move front. You only need the anteriors to come backward. So what we do is, you initially put elastic and you just bring the canines alone. First you bring the canines alone. This is called as a segmented retraction. You bring the canines alone, as you can see in this picture, you are bringing the canines alone, and then later stage you bring the incisors back. Okay, so this is called as a separate extraction. So initially we bring the canines and then later on we brings the incisors in two separate segments. So it's called as a segmented retraction. Next one is the use of temporary anchorage devices. It is also called as mini implants. You can use mini implants. This is one of the best method to augment anchorage. Okay, one of the best method to use mini implants. Okay, so temporary anchorage devices or mini implants allows absolute anchorage, and so for an absolute anchorage means 100% anchorage. So thus minimizing the side effects of unwanted opposing. So in this here itself, in this picture itself is very self-explanatory there. So you don't want the posteriors to move anteriorly, so they have given an implant there. From implant they have given, so implant is not going to move because it doesn't have any periodontal ligaments. So implant is not going to move. Implant will be fixed there. It's like you are putting a nail on the wall. The nail is not going to move. Just like that, the implant is not going to move. So you are putting an elastic. This is an closed coil spring. They are used a spring instead of rubber elastics. They have used a spring. So now this implant is not going to move. Only the anterior tooth is going to move. So it is an higher anchorage case. So this is what with our today's class. So basically, anchorage means resistance to an unwanted tooth movement. You don't want a tooth to move, you increase the anchorage in that particular area. You want a tooth to move, you reduces the number of tooth or number of systems, whatever, in that particular area. Okay, just use your common sense. This is nothing, just a common sense, that's all. Okay, hope everyone enjoyed the class. You have any doubts, anything, don't hesitate to put in our comment. And also please post your feedbacks. Should I be more clear on some areas? Have I missed out? I might have missed out something because I am referring certain books only, so I might miss out certain things. If I have left out any things, if you want me to explain all those things, you please put in the comment box so that I will definitely come and help you guys. Okay, so and also a little reminder, don't forget the SMS. Don't forget to SMS, sanitizing, masking and soap. Using a soap. Okay, use sanitizers, use mask, use soap. Okay, so in this particular time of we all are have facing so many difficulties, so we will be trying our best from our side to help you guys. Only thing is, all these things will come in useful only if you people are reading. So please go through the textbook. You should have doubts. The more doubts, better. Post all your doubts. I will come with my video explaining everything. Okay. Till then, bye bye. Stay tuned. Good night.